some of these adverse childhood events or some of those things that we call the social determinants of health. Therefore, the majority of these patients might feel even a little bit of powerlessness, right? They might not feel like they have a lot of that power in the relationship. And then what we usually do as physicians is that we tell them, this is what you need to do. And if you do X, you'll get better. So a lot of what we do is that we dictate, right? And when we dictate, we're taking the power of choice and autonomy from the patient. So that by itself creates this distrust, because now I don't have autonomy. Now I cannot choose, but rather than telling me what to do.
Welcome to the Plant-Based DFW Podcast Weekly Show with Dr. Riz and Maya, a show broadcasted from the Dallas-Fort Worth area that focuses on lifestyle medicine. This is the use of evidence-based lifestyle therapeutic approaches, such as a whole food plant-based diet, regular physical exercise, adequate sleep, and stress management to treat, prevent, and oftentimes reverse lifestyle-related chronic diseases that are all too prevalent. Every week, they feature a guest who speaks on one of these lifestyle medicine pillars. This show is for you, the person who is seeking to improve your overall wellness and quality of life. So whether you are driving, walking, or relaxing at home, we hope this show will provide you one more tool for your wellness toolbox. Let's meet today's podcast guest.
Dr. Maria Colon-Gonzalez obtained her medical degree at the University of Puerto Rico Science Medical Campus. She then joined Penn State to complete her residency in family and community medicine. While at Penn State, she traveled abroad to gain experience in global medicine. This sparked a passion in Dr. Colon, and she decided to complete a fellowship at Brown University in faculty development for global health. Very early in her career, Dr. Colon noticed the missing link in traditional medicine, that is, patient empowerment for self-care. As an ex-diabetic, Dr. Colon knows the power of lifestyle as a prescription to reverse disease. After finishing her formal training, she became certified by the American Board of Lifestyle Medicine and completed additional training in plant-based nutrition and trauma-informed yoga. She provides comprehensive and holistic care for Hispanic patients in the U.S.-Mexico border. You can learn more about Dr. Colon by visiting her LinkedIn profile. All the links for our guests can be found on our website, plantbaseddfwpodcast.com. Simply look for the episode number, in this case it's 120, and you will see Dr. Colon's bio, her links, and a transcript of our conversation. Also, keep in mind that the Lifestyle Medicine Conference will be coming up on November 7th through the 10th here in the Dallas area. You can learn more by visiting lmconference.org. And I hope you enjoyed this episode.
Welcome, Doctor.
Thank you for the opportunity.
Yes. So I reached out to you because you are a physician, because I also found you through the American College of Lifestyle Medicine. So there are all those components that are so important to the work that we're doing on our podcast and with our community, and as well as yours. So there's so much that we can talk about. I'm looking forward to hearing your story of how you also reversed your own diabetes. Let's start by getting to know you a little bit. Are you from Puerto Rico?
I was born and raised in Puerto Rico. My family is originally from the center of the island. It's a town that is called Lares. And I grew up mostly in San Juan, in the big city.
When you were growing up in Puerto Rico, were you exposed to anybody in medicine, or how did you decide you wanted to go into this field?
Yeah, so I do come from a family where there is a lot of physicians through my mom's side. And I think that also the one thing is I was always passionate about health, and how that passion grew was as I had to learn about my own disease and my own condition, right? So I was diagnosed with diabetes when I was like in the third grade. So, I think that you're like 8 years of age. And I had to educate myself, and I started to realize how important it really was to have a really good doctor. I think that also my own family doctor had a great impact on it. And we were able to have such a good relationship with him. And he was literally, the physician for our entire family. So, that combination of family exposure, good role models, my own disease, right, led me into medicine. Originally, I was going to do more health education and public health. But once I started, college and I started studying, I had a sense that I might have a greater impact if I actually did it through medicine rather than public health.
First, you were impacted by the family physician, and then you realized you can have the greatest impact by being a physician. So I've heard someone else say that, his father was a physician and realized that the path towards wellness was nutrition. However, he chose the medical field because, let's face it, we listen to the physicians. We listen to you guys.
Yes. The white coat, they call it the white coat. Growing up and especially learning about my disease, right? That was one of the things that at home, right? When you think about the traditional Hispanic diet, right? At home, we really had to start changing, right? Yes. So yes, nutrition was very important, but I also had a back problem. And the way that I was able to, treat my chronic back pain was really yoga. And I'm also yoga certified. So I think that through my own healing of path, what I discovered was the power of the body to heal and stay healthy without necessarily all of these drugs, which, don't get me wrong, we do need medications and sometimes, we need them, right? But our body have the power to heal. And I think that we just forget that so much.
Mm-hmm. We do forget that. And I remember reading in your bio about yoga. You use yoga to sort of deal with some traumatic issues with patients. Is that right?
Yes. So, I did my normal yoga certification, my 200-hour, but I'm very, very interested on the impact that trauma has, right, in health. And if you think about, right, the study of the ACEs, adverse childhood events, and medicine, again, has not completely incorporated that into the care of our patients. So I do yoga, breathing techniques, meditation, right? I talk a lot to my patient about mindfulness, and I use that as part of the treatment modalities.
Very nice. And now, how receptive are your patients to mindfulness and to yoga? And of course, you cover nutrition as well. Are they pretty open to all of that?
So I have a mix. Right. I do have the patients that choose what I like to call the easier path, even though it might not be the path that is full of power. But I do have a lot of patients that when they tell me I want to get off my medications, I tell them that is possible. Right. And it's possible as we make little changes at a time and we develop a new way and a new style of living. I think that also, recognizing to our patients that the reason that is hard, or that I think that is hard, is because really we're telling them to go against what the culture and society and media are telling them to do. Right. So that's why it's so hard. And I think that also providing patients with education, like I use a lot of the handouts or even the own infographics that the ACLM has. Right. And I start there with the really basics. And for example, with mindfulness, I just don't tell them go and practice mindfulness. I think that you have to provide the resources. So I have a list of free apps and anything that is free, the patients are open to try because they see it without risk.
That is so encouraging to hear. And so just to kind of let our listeners know, you're in South Texas.
Yes.
So you work with patients that are actually on the border of Texas and Mexico. So how does that work?
Yeah, so in terms of that, yes, there are patients that do cross the border to be seen here. Some of them do have access to insurance if by any chance they also have a home here and they, they're paying for the insurance, right? So they have their own residency here. And a lot of them, so they come especially when they have like acute care. So think about, moms that actually want to deliver in the US. We have a lot of moms that come and deliver here, sometimes without adequate prenatal care. And we have a lot of people also that get sick, that have cancer, right, that get really sick and then cross over here. Those that do not have the capacity to pay for their own insurance and cannot access, the private insurance companies that we know about, there are special programs like the indigent program that the counties have here locally that some of them do qualify. Right. So our social workers are the ones that actually help the patients in that.
The standard American way or the Western diet has really impacted the culture. You touched on it briefly. It's the traditions that we're used to having in our families and in our culture really still keep us there from moving forward. So how do you work with families in that way without feeling like they're abandoning the culture?
Yeah, so I really think that is first giving them options and letting them know, it's one step at a time. Sometimes patients really get scared because they think that they just have to do this kind of like cold turkey. So when you let them know we're not doing this cold turkey is something that is really kind of like it gives them freedom. The other thing is, providing them resources that are culturally specific. And what I mean by that, I think that the name, if I'm not mistaken, is Dora's Kitchen. And if not, I can verify that. But basically, she is based out of Mexico, but she trained with Dr. Neil Bernard and did their courses. Yes, in culinary medicine and nutrition. So she specifically has, a lot of free recipes on the website, and they are completely Mexican, the Mexican flavor, right? And I also let them know, like beans. I mean, all Latinos eat beans, right? So, and they love it, right? So how can we eat more of those beans, right? And perhaps reduce our carnitas, right? Or the red meat. So I think that's one of the things, right? Providing them with those resources that are very specific to their cultures, right? And that they still feel that the food tastes the same.
As a matter of fact, Dora Stone, we did have her on the show a few months ago. Yes. And she talked about Dora's Table is her website and the work that she's done. And what I love most about the talk that she gave early on was about how she wanted to have her be a chef and do her work, but still maintain the importance of spending quality time with her family and her children and things like that. So it's like, a lot of us can identify with how important that is to us. So along with what you're saying as a physician, the increase in diabetes and hypertension, I was hoping we can talk about those kind of things because those are the core morbidities that are putting a lot of people at risk of having further complications if they were to have COVID-19, for example. Well, before we talk about that, can you tell me what you're seeing in terms of your patients? Are you seeing, what are some of the fears that they may have about the virus, about their own health? And I don't know if you're comfortable talking about the vaccine. I know that's a tough topic right now. So,
yes. So, in terms of COVID, right? A lot of what I'm seeing, so first of all, the fear, right? Fear and anxiety. There is a lot of mental health that kind of like has like blossomed, right?
Yes.
And there is going to be a great need for mental health providers, specifically, again, in trauma response and anxiety, that can help people with the sleep and anxiety responses that they're having. So that's one. Right. The other thing, right, that I'm seeing is people are very worried about, am I going to be so now that I have it, am I going to have to be one of those that ends up in the hospital? Will I be one of those that, needs the tube? The area where I am, again, they are very towards their Hispanic Mexican culture. So people here, the DNR, DNI, so do not intubate, do not resuscitate, is not something that is acceptable, right? So we have a lot of families that struggle with, now that my family member is in the hospital, I don't believe in helping them breathe. But then that probably means that they're going to die. So are they going to die, either way? And a lot of family members that have, especially their elderly, family members in the hospital, they struggle a lot with these decisions that, there is a need for ventilators, right? So it's, you have doctors trying to perhaps persuade them, because we perhaps know certain outcomes, but they struggle a lot with that decision. A lot of the hospitals here, like also in other places of the nations, you have a lot of family members that stand outside the hospitals with the signs, and balloons, hopeful that their family members can see them through the windows.
Oh.
So that's a lot of what I'm seeing. And I'm seeing a lot of patients that after COVID, they're developing, the post-COVID symptoms. The most common one is the shortness of breath, the fatigue, the mind fog. And I am seeing patients that, now they qualified according to the DSM-5, right, as PTSD. So I'm also seeing, a lot of patients with classical PTSD symptoms.
I was familiar with the other things like the fatigue and the shortness of breath as in patients that are kind of, I guess, considered long haulers, maybe. But PTSD, gosh, that makes a lot of sense. I wanted to touch on the idea of racial disparities. And I'm sort of still in medicine, that is. I like to think of myself as sort of as a patient advocate, that I try to provide resources and really encourage patients to have a voice when they're speaking with their doctors, so kind of not shy away. I wonder if you kind of have a perspective about it. Why is it that there's so much fear about trusting doctors and feeling safe in terms of asking questions and not feeling like, we're taking up your time? Why is that we see it a lot in the Hispanic community?
Yeah, so I really think that is specifically the not asking questions or being afraid to ask the question. And I have a lot of patients that they might not ask me, the doctor, but then they ask the medical assistant, is because it's more of a patriarchal culture, right? So it's more, they see us as figure of authorities, right? So there's a lot more fear of asking questions and the response that perhaps they might get, right? They don't see necessarily that we're at the same level. And I have a lot of patients that tell me, well, you're the doctor, you know what is better, when I give them between A and B, right? Yes. So that's one. I think that also, again, if you think about trauma-informed care and how slow medicine has been to incorporate that into, our physician-patient relationship and the care that we provide. Why the issue of trust? Well, the majority of the people that come from minority communities, right, whether it be Hispanic, African American, usually, when you look at the statistics, right, they have been exposed to higher violence, higher poverty, right? There are some of these adverse childhood events, or some of those things that we call the social determinants of health. Therefore, the majority of these patients might feel even a little bit of powerlessness, right? They might not feel like they have a lot of that power in the relationship. And then what we usually do as physicians is that we tell them, this is what you need to do. And if you do X, you'll get better, right? So a lot of what we do is that we dictate, right? And when we dictate, we're taking the power of choice and autonomy from the patient, right?
Yes.
So that by itself creates this distrust, because now I don't have autonomy. Now I cannot choose, but rather than telling me what to do. I think that that's one. Second, I also think that some of that distrust also comes from the system. And what I mean the system is, there's the doctor, but then there's the whole healthcare system. And unfortunately, the healthcare system has not responded well to the need of minority patients, right?
Mm-hmm.
Just the disparities. I mean, now those disparities have reduced, but when you think about it, even maybe 20, 30 years ago, and if if you're growing up, that's what you're seeing, right? There wasn't necessarily as many physicians of color, right? There wasn't as many female physicians, right? So for a lot of my patients here, when I arrived to this geographical area, they thought they associated my face with the nurse, right?
Oh, wow.
So I was the nurse, right? And then when they knew that I was the doctor, and what I started to realize is when they tell them doctor, they're seeing this very, kind of like tall, male built, figure. And the reality is I'm 4'10". I weighed 102 pounds, right? So that tells you how petite I am.
Right.
And and I don't look as old as I am,
Sure.
for a lot of people. So, I mean, that even, right, we talk a lot about biases in medicine.
Yes.
And there's the bias that us as physicians we can have, but then there's also, and I say this with, a lot of respect, the bias that the patients can also have, right? Kind of like the baggage.
Yes.
And I think that also creates that dynamic.
Yeah, it's fascinating that you should point that out. Do you remember the hashtag that was going around a couple of years ago, and it probably still is, the I am your doctor or something like that? And it's a variety of different faces, not the physician that we were used to seeing on television, for example, right? Who is always a Caucasian man around his 50s or something like that.
Yes.
I even sometimes because of my age now, as I'm getting older, it's like I see the younger physicians and I'm just like, wow, fascinated by the diversity that exists now. So I love the knowledge that you have about the psychological component of it all, of how we perceive physicians. And you touched on a topic too, previously that maybe our listeners are not used to hearing, and it's on ACEs. I'm a little familiar with ACEs. I don't mention it much here on the show, but if you could kind of just share a little bit with our listeners what that means, and what does that say about why people have a tendency or may have a tendency, say, towards, having weight issues later in life or having certain types of addictions later in life.
So ACEs stands for Adverse Childhood Events, right? It was a study done out of California in Kaiser. And, it's published by the CDC, and the CDC recognized it, if I'm not mistaken, in 1998, right? And basically what this means is, so what are events from, childhood abuse, like emotional abuse, physical abuse, exposure to violence, sexual abuse, neglect, right? Even, we now know that the children, for example, that move a lot, like the children that are, in the army families, like that for them is an adverse childhood event. And basically what science has found out is that when we are exposed to that chronic stress, right, because it's a stress response, two hormones, right, or two substances in our body go up, which is cortisol or not norepinephrine. Adrenaline. So like epinephrine, right, and then the cortisol, they go up. And basically what it does is that it changes our brain, right? So our brain develops kind of like in a different way. There is a great book also that is called The Body Keeps the Score by Bessel van der Kolk. And again, I come trained with the trauma perspective because of my yoga, where we also know now that because we can actually do like the functional MRIs, we know the part of the brains that get affected, but we also know that you're more susceptible to autoimmune disease, right? So there are certain diseases that you are going to be like at greater risk. But at the same time, part of what we know is that because you are exposed to this chronic stress and your brain is different, when you are faced with hardship in life, you don't necessarily have the same skills or the same tools, right? And that other people might know. So at least in my practice, when I see patients that either, so it's not only like substance abuse, right, or mental health diseases, but for example, pain that is usually out of proportion. They tend to be younger, but they have a lot of like complaints all the time. I always ask about a history of trauma. And I am now learning that when you provide trauma-informed care, you don't ask, you just kind of like assume, right? And provide it from that perspective. Because the reality is the majority of us at some point have had traumatic experiences and hardships. And basically that's where that comes from.
Very well explained. Thank you. I find that it's so important to be familiar with content like this, especially physicians, because when you have that and you have an individual who, say, is struggling with weight issues, there's probably a reason behind that. There's probably a trauma behind that. And I think that having compassion for the patient is absolutely important. And I read once that patients can actually feel the judgment from their physicians when it comes to their weight issues.
Yes, and that's true. Studies have shown that that's true, that patients perceive our biases, or that we are, judging them as, you're obese because you don't do the right thing.
Right. And that again goes when you think about why patients don't ask questions or are not as involved or invested in their own health, is because they probably feel judged or stereotyped or whatever it may be by their physician. But these kind of conversations like what we're having now, I think help a lot to get individuals to feel more comfortable with speaking with their physicians and knowing, what questions you can ask. I tend to be the patient that's kind of comes in overly informed. I want to be a partner with my doctor. I want to tell my physician, I've done my work. I think I know what's going on with me. And I keep track of different things. So I may be the other kind of patient, the one that annoys the doctor. I don't know. I'm saying that playfully, but you're board certified in in lifestyle medicine. If we could talk about that, because it's one of my favorite topics. I don't have a background in medicine, but I'm a big fan of it all, and I love to promote it. Tell us, what has been your experience? Because you did start off saying that even in your years when you were living in Puerto Rico, you kind of already knew how to, you were aware of yoga and mindfulness. So these components were already sort of part of your life.
Yes. So I think that, yes, I knew about it in my own journey. But because medicine lacks so much of it, right? Perhaps I was not using it as much with my patients when I was like in residency and fellowship, and when I was still in training. But I think that I probably got very tired very early on in my career in the fact that the only thing that we would do is like prescribe medication and prescribe another medication and prescribe another medication. And, your blood pressure is not good. Well, the majority of the patients need 3 medications. And patients might not necessarily, patients were not getting better. And it was just this like, kind of like machine writing scripts. So I really started to look for what was out there. I knew about integrative medicine, right? But all of a sudden, I found out lifestyle medicine. And at that point, I had a colleague at the University of Texas in here where I am, that she actually was at the first class that took her boards in lifestyle medicine, Jenny. And she told me like, oh, yes. And she kind of like also, provided like this inspiration of like, it is possible, right, to do it with the patients. And I'm also a family physician, right? But I feel like my niche and like my group of people, like I feel so much at home when I am with my colleagues from ACLM, because I think that, at least based on my perspective, it's like we're more aware of really what patients need. Yes. And how to really empower them to be healthy, rather than just trying to fix them with all of these drugs. And again, medications are good and we need them, but I really think that health is so much more than just, the disease.
Yes, definitely. I like that. How do you use yoga to heal trauma?
Yeah, so really good question, right? It depends really of, what your client or what your patient needs, right? So the best way for me to explain this is, so trauma lives in the body. And, so one of the therapies, right, that we use, or one of the modalities, is what is called somatics. And that comes from Peter Levine, right? And really, yoga has been, study in terms of the effect that it has in the body. And the reason being because it helps the patient, right, be aware of their body sensations. How are they breathing? We in a yoga class that is for patients that come with trauma, or that it's trauma informed. Again, we don't tell people what to do. We give them the power of choice, right? And there is a lot of yoga therapists now that is specifically for trauma. So we give them options. And the reason to give them options first is because we do not want to, take away that power of them making the decision, of the autonomy. But at the same time, it's with the purpose of, are they paying attention to their body, right? Can they sense what their body needs today? And that's why I say it might be gentle, and today maybe what they need is that more gentle, soothing, right, kind of like regeneration, re-energize of the body. But it might be, right, that today they need something that helps them release energy and helps them, release negative emotions, right? We also provide kind of like a space to what we call kind of like free flow, right? So maybe 5 minutes or less, where the patient can just kind of like do any pose that they feel that their body needs, right?
Mm-hmm. Is it at a clinic, like in a clinic setting, or do you send them to watch some videos at home?
Yeah. So first, I might do some stuff with them in the office, believe it or not.
Awesome.
Right? Yeah. So I might do it with them. So that's one. And second, for some of my patients, right, I recommend that they read Bessel van der Kolk's book, The Body Keeps the Score, because I think that helps them start to understand the connection. And then, the other thing is I might refer them to, depending, yes, some videos online, but if I also know that they're open to actually going to a place like a studio, right? I'm very familiar with a lot of the studios in this area, and I might refer them to a studio that I think is going to be a good fit for them.
Yes. Okay. Awesome. And also, I was reading, so you have a background in naturopathy.
I try to perhaps offer that as a first option in some areas. And the reason being, because patient in these area, if they can do like the herb or, like the natural remedy, they prefer that.
I was going to say, that's why I brought it up, because I was thinking with your upbringing, with your background in Puerto Rico, meaning that in some Spanish-speaking countries, a lot of us kind of look to the alternatives anyway, right? So, I mean, every time I have chamomile tea, I'm reminded of how I used to drink it in Mexico, which was not in a bag. It was the flower, right?
Flower, yes.
Yes. So all the different things, have a little bit of water with lime or whatever it may be. So I feel like in many ways, people are more open to a more gentle, holistic approach as opposed to medicines.
Yes.
And yet, when it comes to using food as medicine, there's some reluctance there. I don't understand that.
And I really, when I hear patients, I think it is because first, when people hear, oh, eliminate all animal products, yes, right? And you explain to them what that is, people are like, what? Right? And I think that there's still a big need to educate people on, no, there are these other sources of protein, and you won't have like a nutritional deficiency, like you won't, right? And I think so I was doing some work for one of the federally qualified health centers locally here, and it was either a study in PubMed, I cannot remember, but I did read about how for people that come from a background of poverty, right, having the meat on the table really meant that they could provide, right? Mm-hmm. So for the parents in those homes, right, having meat meant, oh no, in spite of everything else, I can still provide for my family, right? So I think that that's also part of what it is. And then, of course, people are so afraid that they're going to lose in all of these flavors. And I would say the other big component is media and, culture, right? I mean, do you see in television, right? Do you see any ad that is about eating this very wholesome, not even salad, right? Just think about maybe like a bean salad, right? That you're eating that has kale, right? And has like all the peppers and all the flavors. Like, I mean, really, that's not what you see. It's the same thing that I tell my patients, right? You have all of the ads from the pharma coming in.
Right.
Right? That we do not have ads coming in of like, you can heal your diabetes with what you eat.
Right. Exactly. I mean, and then, so that's where we're sort of outnumbered. This is the way that this is our media right here.
Yes.
So, and I meant to ask you, have you developed any kind of online programs for your patients, or when you couldn't see them, say when there was a lockdown, or have you considered doing anything like that for the future?
Yes, I have considered doing it for the future, definitely. Right now, in the setting that I work, a lot of what I do is that I use the community resources. And I specifically work with a nutrition program that I was able to tell them, this is the type of help that I want you to give my patients. And I was able to work with them, my patients that have like diabetes, Brenda Davis, my patients that are looking for intermittent fasting, Dr. Walter Longa, and I did this kind of like list. This is what kind of like my style. And they were actually super impressed. So not only of like my knowledge, right, but of the fact that I actually had this, for these type of patients, this is the type of help that I'm providing depending on the disease. Right.
That is a great way to put it. I was wondering if you have any kind of success stories or anything significant that you've seen within a patient that finally said, yes, I'll go this route. I'll practice some lifestyle medicine. I'll walk. I'll eat more plants. Have you seen anything like that with your patients?
Oh, absolutely. I think it was actually last week, right? A patient that came, he has not only lost 30 pounds, but, so I talked about plant-based. It just happened to be that he also has a colleague that does plant-based. And they, the colleague started giving him like recipes and things to try. So when he comes to see me back for his blood pressure, one of the things that he tells me is, I can run better now. And after my run, it doesn't take me as long to recuperate, right? And, that's part of what I try to do with all of my patients, because patients sometimes focus like on the number on the scale. But he himself brought up how different he was feeling, how much energy, how much mental capacity, how less he needed between workouts to recuperate, right? Yes. And he was like, oh my God, this is the best thing ever. And I was really happy for him, right? I tell him, you know what, continue to monitor your blood pressure, because the way that you're going, I wouldn't be surprised if we have to eliminate one of those medications, right? And we have to start reducing the dose. The downside to this is that at the same time that he's telling me this story, he's telling me how, I think it was the wife, went and bought from specific fast food for the kids, right? So I think that, again, as a family physician, part of what I think that we're still missing and an area to still develop is how to do this to the family. Mm-hmm. So not the patient, but the family, right? Because what's good for dad or what's good for mom is also going to be good for these kids. Because if not, what these kids are learning is like, oh, I can now eat from the fast food. If I get like daddy, then maybe I need to adopt a different lifestyle.
Right. I completely agree with that. It's rather than looking at this is a lifestyle for the sick family member, this is a lifestyle for all of us so that we can support our loved one and hopefully not have those issues as well, because we know it's not genetic, right? It's what's on our table yes. that contributes to it all. This yes. has been so nice getting to know you. Do you have sort of like a final message or anything else you'd like to share with our listeners?
Yeah, so I think, for everybody that is out there that is listening, if you're new to lifestyle medicine, I would say it is the way that you can take care of yourself and be empowered to stay healthy. Food, nourishment, right? Movement, the connection of your mind, body. And it's really going against what culture is telling us that we need to do, but it's really the way of staying out of like the 2, 3, or 4 stents. And if you go the way the culture goes, that's where you're going to end. So if you're new, it's actually really good that you're exploring it. If you're not new, I would say continue to invest in yourself and learn about it and practice it as a family thing.
Mm-hmm. Thank you so much. And if people are interested in learning more from you, what's the best way to do that?
Yes. So the best way to do that is through LinkedIn. You can find me in LinkedIn. Just put my name. I think that you also have the link for that. Mm-hmm. And you can actually send me a message there through LinkedIn. And also kind of like know what are the resources out there that in a way I would recommend that you use for yourself or explore.
Awesome. Well, thank you so much, Dr. Colon. I know you're staying pretty busy, but I appreciate the time you gave us today. Thank you.
You're welcome.
You've been listening to the Plant-Based DFW podcast show. If you like our content, please like, share, and leave a review. Our goal is to provide quality episodes to help support the community.